Hello guys, good afternoon. Welcome back to my YouTube channel. This is Miss Henderson. I hope you're having an amazing day. It's such a beautiful weather outside. I just decided to create a few CNA test questions for you. Again, these questions can help you to pass your Prometric exam or your CNA exam. So they're not meant to replace your reading in any form or any shape. They're just meant to supplement your reading and to deepen your understanding of the content, how the questions are worded on Prometric and your CNA exams. So let's look at the first question. When a resident husband begins telling the nurse's aide how to care for his wife, the nurse's aide should A. Accept that the husband has always been in charge. B. Explains that the nurse's aide is certified and above the care. No. Understand the husband wants staff aware of his wife's need. D. Disagree with the resident's husband. So take a moment and think about this question. What do you think is the correct answer for this question? I'll give you a moment to come up with the answer and then I'll tell you the answer. I hope you came up with C. C is the correct answer for this question. Understand the husband wants staff to be aware of his wife's needs. So, that is the correct answer. The husband wants you to, provide the best care for his wife. So, that's why C is the correct answer for question number 1. Let's look at question number 2. A resident with a feeding tube is scheduled for a shower. And a lot of times in the nursing home, when you're working as a CNA, a lot of times these patients or these residents have a gastrostomy feeding tube. The resident's feeding tube is connected to a feeding pump. Of course, a lot of time the feeding is connected to a pump whereby the nurse sets the flow rate of the pump. Which of the following responds by the CNA? Disconnect the feeding tube? I don't think so because that's not within our scope of practice as a certified nursing assistant to disconnect a feeding tube. B. Protect the pump with a plastic bag. C. Ask the charge nurse assistance with the feeding pump. D. Give the resident a bed bath instead of a shower. So take a moment and think what will be your best judgment to do, and I'll tell you the answer. So that moment is up, and I hope that you were able to come up with C. Ask the charge nurse assistance with the feeding pump. Of course, the charge nurse is an RN, and she is a certified RN, and that is within her scope of practice, so she can help with the feeding pump. We cannot touch the feeding pump or change the flow rates or disconnect it. So C is the answer for question number 2. Question number 3. When caring for a resident who is comatose, the nurse aide is expected to. So first you have to know the word comatose. What comatose means is basically patient is in a vegetative state. They're comatose, they're unconscious. Provide mouth care once a day. Avoid changing the resident's position. Talk to the resident while providing care. Keep the resident's room dark and quiet. What do you think is the correct answer for this question number 3? Take a moment and think about it. So that moment is up, and I hope you came up with C is the correct answer. Because if a patient is in a comatose state, the last senses to go is your hearing. So they can hear you while you're providing care. So you still, as a nursing assistant or a nurse, you still have to explain what you're doing to the patient, talk to the resident while providing care, because their hearing is the last senses to go. So that's the correct answer, C. Let's look at question number 4. If a resident is lying in bed and vomiting, why the nurse aide need to turn the resident onto the side quickly? So think about this. Somebody's vomiting in bed. What would be your judgment to turn them to the side quickly? A, to get the resident in a comfortable position. B, to get towels placed to protect the bed linen. To keep the vomit off the resident's face to prevent aspiration. So if somebody is vomiting in bed, why would you turn the patient on the side, like on a recovery position? I hope you can come up with the correct answer. The correct answer for this question is to prevent aspiration, because you don't want the patient to aspirate on their own vomitus. So by turning them on the side, on the recovery position, you're allowing the secretions to drain on the side. So D will be the correct answer for question 4. Question number 5. Let's look at this one. A resident reports having a very large bowel movement. What should the nurse aide do first? Reports this to the charge nurse. Ask if this is a normal pattern of the resident. Suggest the resident drink more water and increase foods with fiber. Or check if the resident is getting medication to help with bowel movement. So what would you do? If you went to a patient and they had a large bowel movement, take a moment and think about it. So guys, the moment is up, and I hope you came up with B. Ask the charge nurse if this is a normal pattern for the resident. This might be a normal pattern with his bowel movements. So B will be the correct answer for question number 5. We have the last question here, 6. The purpose of a gate or a transfer belt is to, a lot of times when we teaching the CNA students, we show them how to use a gate or a transfer belt. That's part of your skill as a certified nursing assistant. So what is the goal of the transfer belt? Limit physical contact with the resident. B, protect the nurse's aide back. C, help steady and support the resident when transferring. Allow resident to transfer or walk independently. Take a moment and think about this question. So guys, that moment is up. I like to give you the chance to answer these questions. So the goal of the gate belt is to help steady and support the resident when transferring. That's the goal. A lot of times the residents may have impaired balance, and a lot of times we'll use assistive devices such as a gate belt or a transfer belt. And these devices is to help to patients with unsteady gaits while transferring them. So C is the correct answer. So guys, that's it for now. Those are the questions I have for right now. I will create more videos. I'm quite busy these days, but I'll try to create more videos to help you guys. My goal as a nurse educator is to help students to pass their state board exam and their prometric exam. Again, if you like these types of content and these types of video, please subscribe to my YouTube channel. Please give this video a thumbs up, and please drop your comments below what other videos, educational videos, you would like me to provide you with. Thanks for watching, and I'll catch you in the other video. Bye for now.